It's the drug test grudge match, urine versus hair versus saliva. Stay tuned and we'll see who wins. Hi, my name's Mike and I'm with Health Research Systems. We've been in the drug testing industry for over 28 years and we're doing these short videos so employers can utilize them in a daily safety meeting or settings where time is short in order to get the information out there about the company's drug-free workplace program. And this is video number 9 in our employer training series. And today we're going to talk about urine versus hair versus saliva. Employers want a safe and healthy workplace. And so 2/3 of them test workers for drug use, according to recent research. But which method of testing is most effective? There are currently 3 primary methods of specimen collection. Urine, which is by far the most prevalent. It has 90% of employers using it. Saliva, used by 5%, and hair, used by another 5%. The vast majority of employers use urine testing over saliva or hair primarily because it's what people have always done. The typical organization looks to the DOT, which tests truck drivers and airplane pilots and so forth. And because it still uses urine testing, it's the de facto industry gold standard. Alternative specimens are gaining interest, both hair and oral fluid. That type of testing has had double-digit yearly growth as more companies become aware of them. When comparing the number of people who self-report drug use to the National Institute of Drug Addiction and the number of positive test results from nationwide labs, urine screens don't detect as many drug users as would be expected. It's necessary to point out that urine and hair testing pick up many different drugs, such as prescription meds, which get overturned when reviewed by a medical review officer, while oral testing panels are typically screening only for marijuana, cocaine, PCP, amphetamines, and opioids. Medical review, which determines whether a legitimate medical explanation can account for positive test results reported by the lab, is an important piece of any workplace drug testing program. Here's some of the pros and cons. Urine testing, or urinalysis, is one of the approved drug testing methods for workplaces covered by federal guidelines. It's easy to collect the specimen, which can be screened for many illicit drugs as well as prescription medication. Urine as a specimen is very easily manipulated, though. There are literally hundreds of websites out there that sell adulterants and synthetic urine for people to buy that can subvert a urine drug testing program. But cheating is not that easy. While employers typically don't observe workers while the specimen is collected, increasing the risk of tampering, a urine screen is difficult to cheat as the temperature, pH, creatinine are all checked to ensure specimen integrity. Attempts to dilute a urine specimen will only create a specimen that is inconclusive and requires a retest. Saliva testing. Oral fluid testing can be collected immediately on site, which makes it more efficient and reduces the amount of time and cost for collection. The test can detect use that has been extremely recent, where urine tests require the drugs to have passed through the system in order to identify the metabolites. Saliva testing has a lot of appeal because of the small detection window from a few minutes up to about 48 hours. Oral tests are likely catching chronic daily users. These are the people you want to deter and keep off your job site because they represent the most imminent risk. But the limited detection window is also its drawback. It can only detect drug use that has happened within the past couple of days. Hair testing. Drug testing with hair is a simple and non-invasive way to detect drug use over a greater length of time. Most effective when testing for regular use of drugs such as cocaine, methamphetamines, and opiates. These drugs can become undetectable in urine after 3 to 4 days. Hair testing has the highest fear factor as a deterrent. Employers that advertise hair testing deter drug-using applicants that just stay away. It's impossible for regular users to prepare for it. On the other hand, it typically does not do a good job at detecting sporadic usage, and it doesn't really cover the few days right before the test because it takes time for hair to grow. Which method should you use? Urine is time-tested and readily defensible, but each have their pros. A combination of 2 of the tests can give an employer the most comprehensive test results and the best look at drug abuse by the donor. So which one is it? Urine versus hair versus saliva? There's no real clear winner, but a combination of each of those would certainly give you a better look at your testing situation. This is Mike with Health Research Systems, and we offer national drug testing programs and background checks to companies of all sizes. If you have any questions, you can email us at info@healthresearchsystems.com. Hit the like and subscribe button so you'll know when we release the next video in this training series, and thanks for watching.